Hi, Portia, and welcome to
Hello.
Calm and Courageous podcast. It's a parent's guide to powerful allyship in raising kids with disabilities. Thank you so much for joining me.
Oh, I'm so excited to be here.
Portia, could you tell us a little bit about you and your journey in motherhood right now in this season?
Oh, yes. What a journey it has been. So, hello, and thank you for having me on the show. My name's Portia Jackson. I'm a wife. I'm a mother of three girls, 13, 11, and 6. My oldest daughter, Johanna, or Joe, as we call her, or JoJo, she has multiple names here, has a condition called lissencephaly. So, it was a malformation of her brain that was just a random genetic anomaly. So, nothing that we did wrong or anything like that. We didn't realize she had that until about age of 1. So we this is something we've been, I don't want to say dealing with. It's been something that's been in our lives for about 12 years. Also I have my dog Vino. He's my boy. So three girls and a dog. And he's 4. So yeah, it has been a journey. But at the same time, being a Christian and being a follower of Jesus, I can see how God is working through her. So it really is just one of the biggest joys of my life to be like firsthand to seeing a miracle in progress, which a lot of people we just tend to read about it like in the Bible. It's like, oh, that's back in the day versus seeing it live. But it's also at the same time, if I'm being honest about it, which I always am, it's also one of the biggest challenges in life too. So it's one of those double-edged things, and yeah, it's been a journey that we're still on.
Portia, I love that you're sharing this. And I don't know if you know much about me, but my journey in motherhood.
Hmm.
I have 4 kids, 2 boys, 2 girls, and 2 of my kids are hard of hearing.
Hmm.
And we didn't know until they didn't pass the hearing test. And so it was just like, most people will go their entire lives and never meet a deaf person. I don't know if you think about it, you probably
Yeah,
or you meet someone who has lost their hearing later in life, but
right.
to meet someone who was born hard of hearing or born deaf, I didn't realize how ignorant I was about the deaf community and disability in general, especially in the church. There's a lot of laying of hands. There's a lot of, God, only good and perfect things come from God. This is
Yeah,
God, let's take it away. And not to say that that doesn't, you know, there isn't a place for that. But there's
right,
also a place where God moves in the lives of people with disabilities. And it's not always miraculously taking it away. It is
right.
so that God's power will be made clear and be shown through this child's life. And we will see those miracles in little ways, little progresses, opening the doors to Christ, meeting, showing the love of Christ to people who are non-believers through your child. So
Hmm.
I went off on a tangent just by what you.
Yeah. No, it's so true though, because I mean, even with the deaf part that you discuss, I wasn't super aware of it. But one of the shows I did enjoy watching a few years ago was Switched at Birth. It was on, I think, like Ava's Family or whatever.
Yes.
But like even that just gave me, because I don't have anyone in my family that's like that, but it gives you more of a perspective of, oh, I get it. I'd never thought about that. And even with Joe, um, it's not anything. I didn't think about ADA, right? Laws, or I didn't think about ramps or things like, even with being a mom, right? Like how many moms that don't even have kids that have special needs are grateful for ADA, for the ramps, for just a stroller on a walk, right? Not have to take the whole thing down. And that's just one small part, and things like that. So like now I can see, just because I'm attuned to it, I can see a child that has special needs like a mile away. Like I can give
Yeah.
them a encouraging smile, or like we just know. It's just like
Oh
this
yeah. It's like a
secret club where I'm like, you got this. Like it's just a head nod. And so that, or even like adult changing tables. Johanna is 13 years old. She's over 100 pounds. I'm hanging on to this last half an inch I have with the height here.
yeah.
Um, but those koala care things, those things were straining and grunting and moaning under the weight of her like years ago. So now we have to look for adult changing tables and people who use them at the airport, which it's so rare to find an airport that even has that. So it's like, no, I don't want to change my child on the floor of this dirty bathroom. And ran into one mom that's like, oh, well, we're potty training little Johnny or whatever his name was. I'm like, they have a family bathroom for this reason. Like, this is literally for someone who has no other option. It says adult changing table. So it's just things like that. I think people just don't recognize until you're in that situation.
Yeah. Yeah.
Like same people who get like annoyed with little babies on the plane until you have a little baby that you're flying with. And then all of a sudden you have all this compassion and understanding, right? I mean, hopefully none of us were those mean people on the plane, like as if we were never babies. But the point is it just gives you a whole different perspective and level of compassion for people who are different than yourself.
Yeah, yeah, and that's a blessing. It's a blessing for you to have that. Okay, now I have this awareness, and
Yeah.
I could be about advocacy. It has been so exciting. I
Mm-hmm.
can't say I've ever had anything that's uh gotten me riled up or made me have this much care. It's and nothing.
Yeah.
I used to, envy people who just had a heart for things. I used to be like, oh, I
Yeah.
to LA for acting, but I didn't really care.
Yeah.
If I can't dance, I can't breathe. I've got to get the mic. I never
Yeah.
type of heart for performing. It's just the truth.
Yeah.
But when you realize, just like you were saying, Portia, hey, there's a whole community of people who are going to need these adult changing tables. This is about accessibility, and
Yes,
this is about making their lives more functional. And it's
it is.
not something that we have to normalize people moving through life differently and
Yeah.
needing different accommodations. And it is exciting for me that I have this awareness and that I'm like, oh, okay, I know now something else that I could be an advocate for and be an
Mhm.
ally and a support to. It's thank God. That is where you see
Yeah.
the work of God. That is
Yeah.
where,
And it's also been kind of like, even just personally, if I look at the amount of faith that I've had to have in my walk with Jesus as my Lord and Savior, and what I've had to rely on with this journey for the past 12 years. Because when she has her birthday, we think, okay, it's your birthday, but it's also kind of like our birthday for knowing that we have this new journey ahead of us because she started having seizures a couple of days before her first birthday. Because we had this, huge party, everybody coming in. We're like, what is going on with this? Like, and it's just really terrifying seeing like your child because she had seizures. That's how we knew. She had infantile spasms, which is it's like where like your body like just freezes, but it does it like 20 to 30 times in a minute. And then it just goes away. And then the medication for it is it just makes them just numb. Like she would just be like laying there, kind of like a bump on a log. And keep in mind, this is a 1-year-old going into like the toddler years where they're busy and chasing around, and my kid wasn't. So it's shown me a couple of things. One, to trust what some call the instinct, I call Holy Spirit. When she was 2 months, I remember she had some type of weird movement. And I was like, well, let's check it out. Took her to the doctor, and they were like, no, we don't really see anything because it wasn't consistent enough. And like, sometimes they're new to their bodies. So they just make these weird movements. I was like, all right. They're like, if you see something else, bring her back. But then, you get those little weekly newsletters like, oh, your child
yeah,
should be doing XYZ. I'm like, oh, we're a little bit behind. Everybody's like, you're a new mom. Don't worry about it. You think everything is wrong, which to a certain degree might be true. But in this case, I'm like, I know something is a little bit like no kid is this chill. And so they're like, no, we'll keep an eye on it by her first year appointment. If she's not doing this, we'll take a look. We didn't have to wait. Like the seizures presented themselves. However, one of the first things we did was turn to prayer, and we turned to the word of God. We put
yeah,
all these healing scriptures up, which I already had because our former pastor, Holly, and her journey through cancer, she had already put together some scriptures. So I'm over here printing them out. We're decorating, we're putting them all around the room. So I'm like, I don't know what else to do. Like that was my natural thing to turn to. And when I meet other moms with other and dads with special needs, it's like there's been so much divorce. There's been a lot of people on antidepressants. There's a lot of people who are just struggling. And I'm just so grateful that I've had my beliefs in my face, and I can like rest on the promises of God to get us through this. Also, I was never one to like really be like, do you know Jesus? Let me tell you about Jesus. It's just like, nope, see you at Sunday or on Sunday at church. Hope you get there, right? But now it's like an easy way for me to be like, look what God is doing in our life. Like this is how we do it. Because people are like, how do you do this? Because it's a lot. I mean, she has 15 plus hours of therapy a week. She's in the mod severe class at her school. It's just a lot. However, God is bigger, right? So it's just kind of like, this is what we lean on. And so I'm just like, you know what? we have a lot of people in our lives that are not believers. If this is their way to see God work, if this is their way to see God move, if they come to Jesus through what they see with Johanna, through something that we've said, totally worth it. I would sign up for it over and over
Yeah,
again.
come on, Portia. I love
Yeah.
this. And I agree. That's exactly how I feel.
Yeah.
And and I do, I hope I'm not saying this wrong, but it's like 2%. No, I don't even want to say it. But
Uh-huh.
I read a thing because I could be wrong. If someone sees this and I'm
You
wrong,
heard it on the internet, so it's
yes,
true.
someone. So I could be, but like of the deaf and hard of hearing community are Christ followers.
Yeah.
So oftentimes when people are introduced to Christ who have a disability, it's usually through this lens of let me lay hands and take this thing away, which is nothing's wrong with that. I believe in mission.
Right.
I'm always about that. However, sometimes it's just about sharing the power of Christ. And I think
Right.
what you're saying is, hey, when I meet these families, this is an opportunity to say, look at what God has done in my life. Look at
Mm-hmm.
how my family is still thriving. Look at how
Yeah.
my daughter is making, meeting new milestones. And look at how I'm still standing. I have not lost.
Yeah. It's the fruit of the spirit. Like our lives have literally been fertilized. I don't know, but like the love, joy, peace, patience, kindness, goodness, faithfulness, gentleness, self-control. We've had to develop all of that in the midst of parenting, being sisters to Joe, all of those things. Like they have to learn to be patient with her too, like our oldest is in a different position because she's not the oldest as far as age, but she is the oldest as far as cognitive ability because Joe is 13 physically and she like literally is a grown woman. I'm like, I can't believe I'm buying bras right now. Like, what is this like part of life?
Yeah,
But mentally, she's like a 1 year old,
yeah.
right? Physically, she's maybe two. And she's making progress, but it's just a different part of life. And that was my prayer at first. Like, what did I do wrong? Fix this, remove this. And now my prayers have, I believe, matured to the point where it's like, help give me the strength to do what I need to do. What do I need to be learning from this? Who needs to be exposed to the not exposed to it, but like who in our life needs to see your power through what we're doing, through how we handle this, through this. And there's been blessings. Like the girls don't even know what it looks like to wait in line at an amusement park because we get the fast pass and stuff. Not the fast pass, not the one you buy, but the one because like your child has a disability, right? They don't know what it's like to wait in line to get on the airplane because we get on first. Although Southwest has changed their policy, not loyal to them anymore. But the point is, they've had little perks along the way too, right? But bigger picture is I almost believe because I have to pull it up, but our girls listen to this devotional in the morning called Keys for Kids. I listened to it and read it when I grew up. Well, not listen to it because we didn't have apps back then. Whatever. But I used to read it, and there was this one story about this girl, and the girls were like, "Oh, that kind of sounds like Joe." And she was praying like, "Well, I know God is healer. Why hasn't He taken this away from me?" And I should have had it pulled up, but I'll try to find it, and maybe you could put it in like the show notes or something. But it was so good because it's just it just really showed that sometimes, like you said, God will do something immediately, and sometimes God is doing something else because it takes some time to develop that in people. And I don't know if he's developing me, if he's developing my husband, if he's developing somebody else in our life, somebody we've never met yet. Like, I don't know what God's intricate plans are, and nor can I ever even feel like I'm on his level or on their level to figure that out.
Portia, you are ministering to me today.
I'm going to find this. I'm going to find it and send it to you because it was just so clear. It was just so clear. But anyway, I'm going to try to multitask while we do this. But
Yeah, do
uh,
that. I'm also just going to ask you a little bit. I love hearing you talk about your daughter and just about, they're asking questions and, for my son, he's so my
got it.
typical hearing child who's 8,
Mm-hmm.
junior, I am a junior. It's him, and then it's my second born who has the hearing loss. My second and third,
Mm-hmm.
well, my middles, they both have the hearing loss. And for my oldest, I remember it was hard for him because he was like, well, I don't know why he's not talking to me right now. And
Mm-hmm.
so because his speech developed later. And for Elijah, it's because when someone is hard of hearing, it's the brain and how the
Mm-hmm.
brain processes the sound. and it's different types of hearing loss. And but for Elijah, he does not access spoken language the same as his little sister. She
Mm-hmm.
same hearing loss, and she's chatterbug. They both wear hearing aids.
Mm-hmm.
Elijah does better with American Sign Language. So we're as a family, we're learning both.
Mm-hmm.
And I'm saying all that to say, for my oldest, that was hard, right? Because his friends had siblings that they weren't having to learn another language. And for my second born, it caused him not being able to express himself, caused him to have some frustration and some
Yep.
behaviors. And so could you share, was there any like emotion that your other children, your other two daughters felt, or was they accepted, or did they have a hard time with it at all? Or how
Yeah. So keep in mind, so with Joe being the oldest out of the three, not including Vino, they don't know any different, right? So my middle one is 2 years younger than Johanna, and then my youngest is like 6.5 years younger. So they have never seen any different. Um, my middle one, Jessica, when she was growing up, she would, just like any other kid looking at their big sister, right, would mimic some of her behavior. So some of the sensory seeking activities that Joe does. So rocking back and forth or just doing things that wouldn't really be appropriate for other children because this is her way of seeking and getting that stimulation. Because again, it's the same thing. It's a with her brain. So that if you look at it, typical brains are very squiggly and stuff. Joe has a very smooth brain because she doesn't have all the same connections, which takes her longer to make those connections. It takes a lot more repetition for her to learn something. So yeah, so Jess will be like, well, why can't I do that? I'm like, well, it's not really appropriate and things like that. She's like, wow, my sister's different than other ones. And we're like, and that's okay. Everybody has a disability, right? It's just that some are visible, some are not. Some of us have disabilities from childhood upbringing. Some of us have disabilities from what the enemy is putting in our mind, right? My belief is everyone has a disability, and that's why we need Jesus. Um, for our younger one, she's has such a caring heart. Like she's so good. They both are. They're both good with their sister. And I think they've gotten to the age where it's like, this is our sister. Like if you have something to say that's not nice, because we did have one friend that came over, and we always say if you have questions, let us know to both the parents and the friends. We're an open book, and usually we will kick that off to be like, oh, this is Johanna, this is her condition, this is what it means. If you have any questions, let us know. But we did have one friend that came over from school that I feel like was just didn't have the kindest spirit about her questions. And she was like, what's that smell? Because Joe still wears diapers, right? And so it was Jessica and then our cousin, who's like a year or two older than her. And he was like, she wears diapers. Like when you poop, it smells for you too. Like you're not special, you know? So she hasn't been invited back over just because I'm like, we don't really need that in our house. But overall, the girls have been great with it, primarily because I don't think they know any different. Um, and they too can see when other kids have behavior issues or if they have special needs. They're like, oh, she's like Joe. That's what they call it. They're like, oh, she's like Joe. And so I'm like, yeah, so be a little bit more patient. You know, if you have a question, you can always go ask the parent. And I'm just like, because either ask your question or move along. Don't stare, you know, because everybody, their disability is different than Joe's or their condition. I think we like calling it a condition versus like a disability or whatever, because who doesn't have a disability, right? So I'm like, it's okay if you have questions, you can ask us first. So myself and my husband. And then if we don't know, we can always see if it's okay to ask their parent about that because we're open to those questions too. Or if we see someone staring at Joe when we're out and about, when we're outside of our bubble, as we say it, right? Because school and home, therapy and home, family, everybody knows what's up. So we just kind of get comfortable and we forget, oh, wow, our family's different. It's when we go to the airport, when we go to an amusement park, where we're like, oh, that's right. We're way, way different than other people. Like this is a physically and like visually different thing for most people. So when we see something that's different or unusual, what's our natural thing? To stare. So that's given me some empathy with, okay, they don't know what's going on. They're trying to figure it out. And so I approach it more from a, hey, do you have any questions? This is my daughter, Joe. She would, you know, feel free to say hi, as opposed to I've seen some people just come across just kind of rude. Like, what are you staring at? And it's just like, okay, you have to remember if you see a car accident on the side of the road, you're staring at that too. Before you had a child with special needs or someone that you knew, you probably would be looking like, what's that sound? Why are they drooling? Like what it like that's just a natural thing, you know? So it's just having empathy for both sides.
Yeah, yeah, absolutely. I agree. You know what? This time has gone by so fast.
Yeah. Oh, I found the story too. So let me know if you want me to just send it to you or if you want me to just read that last part. But yeah.
Oh, I want to finish with your story, but I do have a quick question before. What kind of support has been most helpful to you? Family, friends, online communities?
Oh, great question. I would say by far the biggest support has been this Facebook group that I found for this condition because we got her condition after all the testing. It came through an email from our insurance company, which I'm a big fail to them. Who gives you this diagnosis that we have to Google because it's lissencephaly? I'm like, what is that? Do you know what that is? I'm like, is this a vegetable? Like, what is this? Had no idea what it was. Googled it. You Google a sneeze and you're going to die from lung cancer
Oh,
tomorrow,
of course.
right? According to Dr. Internet. So I was like, what is this? We're seeing all this stuff that's like your kid's going to die by the age of 2. Keep in mind, we learned about this condition when she had just turned 1. So you can see we were not in the best space. So and I ended up coming across a blog, emailed the lady, and she was like, okay, first thing, stop Googling, join this Facebook group. You're going to see a lot of information in there. Unfortunately, it's grown a lot since then. I just say unfortunately because that just means more kids have this condition. However, that Facebook group, I scrolled all the way back to the beginning and started reading every single post to learn what I could. That Facebook group gave me the drugs to present to her doctor to try because it's such a rare condition that the doctors are practicing medicine, right? So they call it that for a reason. So they didn't know they're giving her this some generic seizure medication that wasn't really doing anything except for just making her very, very lethargic.
Yeah.
So wrote out the ideas, presented it to her doctor, her neurologist, and he's like, "Ooh, this is really, this might not work." I'm like, "We're willing to give it a shot." The drug that stopped her seizures, and she has not had a seizure since the first dose of this drug, I found in that group. Um,
Yeah.
the resources that we get through this great state of California, say what you will about California, but it is the best state for kids with special needs. The resources that we found through the state, a lot of them came from that group or came from another resource that then connected me to another resource. So, yes, family and friends have been helpful as far as prayer and checking in, things like that. But as far as like practical support, it came through that Facebook group because moms are going to share what they know, and moms and dads will share what they know, but the group is primarily moms.
Yeah, yeah. Thank you so much. Okay, I wanna because we're running out of time.
Mm.
I do a 30 minutes because I'm like, okay, the show is very new.
Uh-huh.
Let's just do 30 minutes and I'll do longer in the future. But can you just share that and then we'll close out, please?
Sure. So the backdrop of the story, it was called Slow Cooker. So if you get the app, Keys for Kids, you can look up the story Slow Cooker. The girl's in a wheelchair. She sees all her friends and her siblings playing outside on like a snow day. She starts crying, and her mom's like, "Why are you crying?" or whatever. And so anyway, so the mom's making some dinner, the slow cooker, but it's in the morning. So the girl's like, "Well, why are you starting it now?" And she's like, "Well, it's a tough cut of meat. Like it takes longer to develop and get into something that tastes good and is tender and things like that." And so then the mom ends up at the end with saying, so the girl who's in the wheelchair was said, "So you're saying being sick and in this wheelchair for so long may be God's way of making me tender and more like him," because she was relating it to the cut of meat in the slow cooker for dinner. And the mom said, "Yes, I don't know why God hasn't healed you more quickly, but I know he's patiently working in your life for good. He can use hard things to make you more like Jesus, who understands your suffering and promises to be with you through it. I pray each day that he will use this long illness to help you know Jesus better and let his love be seen in your life." So I just thought that was just so perfect. And I screenshot it. I sent it to our family because they're always like, our cousins are like, "Well, why did God make Joe this way?" And I'm like, "I don't know." I'm like, "I guess to show off his glory." But this story was just like, I was like, "Thank you, Jesus, for the way you speak to us," because I needed to hear it on that specific day and I've saved it. And I'm just like, this is why.
Yeah, I love that, Portia. Thank you so much for sharing. Thank you for being on the Common Courageous podcast. I've always just admired you. I've always thought you were such a beautiful woman. And just watching you navigate motherhood and watching you navigate a different condition, something that you didn't know about and that you're educating me about and others, and just showing God's glory through how he uses your family and your daughter, and it is a blessing to know you and watch you. You're ministering to me. as I navigate my children and their hearing loss, I stopped praying for God to take it away, and I started learning about the more I learned about the deaf community. Because I also want to say this for those who are deaf and hard of hearing who may be listening. They have a culture and a community, and they have a lot of and I can't say everyone, but as a culture, as a self-acceptance, and they don't see themselves as lacking anything. I use
Yeah.
disability for our family, but they have another language, American Sign Language, and no one does deafness the same. Some people are aided, some people have cochlear implants, some people use ASL, some people do all. I'm an ally, I'm learning, and I
Mhm.
can't speak for the deaf community. I want to be clear.
Yeah.
I am learning about it, the culture. I'm learning about my children. I'm learning how to be the best mother I can to two deaf children who I love and accept and embrace their deafness now that I'm more educated and understand. So
Yeah.
that too. But also, God's going to do what he's going to do. And
Yeah.
so we are grateful to him and his power, and we're grateful for how he's working through you. And I just am so grateful for you being on this show. And I hope
Thank
you have a
you.
wonderful day. And thank you, everyone who is watching or listening. Thank you so much, Portia. I hope to see you soon. Yay!